Hello, my name is Dr. Katie Giorgini and I'm the Director of Palliative Medicine here at Evangelical. I've been asked today to discuss with you what is palliative medicine and how we serve our patients and families. Palliative medicine is a subspecialty of medicine that cares for patients who are chronically, seriously ill. Those patients have life-threatening and life-limiting illnesses that diminish their quality of life. Some of these diseases include cancer, congestive heart failure, COPD, and dementia, just to name a few. How we help these patients is a variety of ways. Our first focus is on their symptom management. By aggressively managing their symptoms, we can ensure they have better quality of life and live well in their chronic diseases. Some of the symptoms that we manage include pain, shortness of breath, GI distress like nausea, vomiting, and diarrhea, and appetite loss, weight loss, insomnia, anxiety, and depression. We manage these symptoms by talking through with the patients what is ailing them the most and what is diminishing their quality of life. We focus on getting these symptoms well controlled so that they may live better. In addition to focusing on their symptoms, we work on advanced care planning. We have discussions with the patient and their families or whomever they've determined to be their next of kin and power of attorney, so that when decisions are needed down the road in their illness, they've had these conversations and they have their documents in place. Those documents include advance directives, power of attorney designation, and POLST. In addition to symptom management and advanced care planning, we also help the patient and their family transition to hospice care when that time is appropriate. We offer palliative medicine at Evangelical in the outpatient clinic setting, inpatient consultation, as well as travel visits to the patient's home, assisted living, or nursing home. We provide these services to the patient and their family to best care for them in their disease process. If you believe that your family member may benefit from palliative care while they're in the hospital, you can ask your hospitalist team or your surgical team, as well as your social workers or case managers, to see if you would be eligible for palliative care. They can help facilitate that referral to our services. If you're at home and think that your loved one or yourself may benefit from palliative care services in our clinic, you may call our main number. If your insurance requires a referral, we can help facilitate that for you. People ask the difference between palliative medicine and hospice. Palliative medicine cares for those who are chronically ill for the last years of their life. Oftentimes, patients do not need to be terminal in order to receive palliative care. For example, I see many patients who may have a curable cancer while they're getting their treatment. Patients who undergo treatment such as chemotherapy, radiation, and surgery for cancer often have many symptoms that limit their life while they're undergoing treatment. We take care of a whole host of things for breast cancer patients, including postoperative pain, neuropathy, arthralgias, anxiety, weight loss, chemo-induced nausea and vomiting, just as an example. Hospice care is for patients who have 6 months to live or less, as determined by the Medicare benefit. While the 6 months is not an absolute, it means that the patient has a limited time to live and they have no longer chosen to have cancer-directed therapy or disease-directed therapy to prolong their lives. So for example, if a patient who has cancer is no longer getting chemotherapy or radiation, they would then benefit from hospice services at home to both help the patient and the family live their remaining days to weeks to months in the best possible quality. In closing, I want to encourage any patient or family member who feel that palliative medicine may benefit them to reach out to us to set up an appointment. It is never too early to get palliative medicine involved. Patients who have palliative medicine involved from the beginning of diagnosis and throughout their entire disease journey live better and oftentimes live longer due to good symptom control and support for both the patients and their families. Please reach out to us at the numbers provided, and we will be happy to provide our service to you. Thank you.